Learning disability is a classification that includes several areas of functioning in which a person has difficulty learning in a typical manner, usually caused by an unknown factor or factors. Given the difficulty learning in a typical manner, this does not exclude the ability to learn in a different manner. Therefore, some people can be more accurately described as having a learning difference, thus avoiding any misconception of being disabled with a lack of ability to learn and possible negative stereotyping. While learning disability, learning disorder and learning difficulty are often used interchangeably, they differ in many ways. Disorder refers to significant learning problems in an academic area. These problems, however, are not enough to warrant an official diagnosis. Learning disability, on the other hand, is an official clinical diagnosis, whereby the individual meets certain criteria, as determined by a professional. The difference is in degree, frequency, and intensity of reported symptoms and problems, and thus the two should not be confused. When the term learning disorder is used, it describes a group of disorders characterized by inadequate development of specific academic, language, and speech skills. Types of learning disorders include reading, mathematics, and writing. The unknown factor is the disorder that affects the brain's ability to receive and process information. This disorder can make it problematic for a person to learn as quickly or in the same way as someone who is not affected by learning disability. People with a learning disability have trouble performing specific types of skills or completing tasks if left to figure things out by themselves or, if taught in conventional ways. Individuals with learning disabilities can face unique challenges that are often pervasive throughout the lifespan, depending on the type and severity of the disability. Interventions and current technologies may be used to help the individual learn strategies that will foster future success. Some interventions can be quite simplistic, while others are intricate and complex. Current technologies may require student training to be effective classroom supports. Teachers, parents and schools can create plans together that tailor intervention and accommodations to aid the individuals in successfully becoming independent learners. School psychologists and other qualified professionals quite often help design the intervention and coordinate the execution of the intervention. With teachers and parents, social support may improve the learning for students with learning disabilities. Definitions. Representatives of organizations committed to the education and welfare of individuals with learning disabilities are known as National Joint Committee on Learning Disabilities. The NJCLD used the term learning disability to indicate a discrepancy between a child's apparent capacity to learn and his or her level of achievement. Several difficulties existed, however, with the NJCLD standard of defining learning disability. One such difficulty was its belief of central nervous system dysfunction as a basis of understanding and diagnosing learning disability. This conflicted with the fact that many individuals who experience central nervous system dysfunction, such as those with cerebral palsy, did not experience disabilities in learning. On the other hand, those individuals who experience multiple handicapping conditions along with learning disability frequently received inappropriate assessment, planning, and instruction. The NJCLD notes that it is possible for learning disability to occur simultaneously with other handicapping conditions. However, the two should not be directly linked together or confused. In the 1980s, NJCLD therefore defined the term learning disability as a heterogeneous group of disorders manifested by significant difficulties in the acquisition and use of listening, speaking, reading, writing, reasoning and mathematical abilities. These disorders are intrinsic to the individual and presumed to be due to central nervous system dysfunction. Even though a learning disability may occur concomitantly with other handicapping conditions or environmental influences, it is not the direct result of those conditions or influences. The 2002 LD Roundtable produced the following definition: concept of LD. Strong converging evidence supports the validity of the concept of specific learning disabilities. This evidence is particularly impressive because it converges across different indicators and methodologies. The central concept of SLD involves disorders of learning and cognition that are intrinsic to the individual. SLD are specific in the sense that these disorders each significantly affect a relatively narrow range of academic and performance outcomes. SLD may occur in combination with other disabling conditions, but they are not due primarily to other conditions, such as intellectual disability, behavioral disturbance, lack of opportunities to learn, or primary sensory deficits. The issue of defining learning disabilities has generated significant and ongoing controversy. The term learning disability does not exist in DSM-IV, but it has been added to DSM-5. The DSM-5 does not limit learning disorders to a particular diagnosis such as reading, mathematics and written expression. Instead, it is a single diagnosis criteria describing drawbacks in general academic skills and includes detailed specifiers for the areas of reading, mathematics, and written expression. Types. Learning disabilities can be categorized by either the type of information processing affected by the disability or by the specific difficulties caused by a processing deficit. By stage of information processing, learning disabilities fall into broad categories based on the 4 stages of information processing used in learning: input, integration, storage, and output. Many learning disabilities are a compilation of a few types of abnormalities occurring at the same time, as well as with social difficulties and emotional or behavioral disorders. Input. This is the information perceived through the senses, such as visual and auditory perception. Difficulties with visual perception can cause problems with recognizing the shape, position, or size of items seen. There can be problems with sequencing, which can relate to deficits with processing time intervals or temporal perception. Difficulties with auditory perception can make it difficult to screen out competing sounds in order to focus on one of them, such as the sound of the teacher's voice in a classroom setting. Some children appear to be unable to process tactile input. For example, they may seem insensitive to pain or dislike being touched. Integration. This is the stage during which perceived input is interpreted, categorized, placed in a sequence, or related to previous learning. Students with problems in these areas may be unable to tell a story in the correct sequence, unable to memorize sequences of information such as the days of the week, able to understand a new concept but be unable to generalize it to other areas of learning, or able to learn facts but be unable to put the facts together to see the big picture. A poor vocabulary may contribute to problems with comprehension. Storage. Problems with memory can occur with short-term or working memory, or with long-term memory. Most memory difficulties occur with one's short-term memory, which can make it difficult to learn new material without more repetitions than usual. Difficulties with visual memory can impede learning to spell. Output. Information comes out of the brain either through words, that is, language output, or through muscle activity, such as gesturing, writing or drawing. Difficulties with language output can create problems with spoken language. Such difficulties include answering a question on demand, in which one must retrieve information from storage, organize our thoughts, and put the thoughts into words before we speak. It can also cause trouble with written language from the same reasons. Difficulties with motor abilities can cause problems with gross and fine motor skills. People with gross motor difficulties may be clumsy, that is, they may be prone to stumbling, falling, or bumping into things. They may also have trouble running, climbing, or learning to ride a bicycle. People with fine motor difficulties may have trouble with handwriting, buttoning shirts, or tying shoelaces. By function impaired. Deficits in any area of information processing can manifest in a variety of specific learning disabilities. It is possible for an individual to have more than one of these difficulties. This is referred to as comorbidity, a co-occurrence of learning disabilities. In the UK, the term dual diagnosis is often used to refer to co-occurrence of learning difficulties. Reading disorder. Reading disorder is the most common learning disability. Of all students with specific learning disabilities, 70 to 80% have deficits in reading. The term developmental dyslexia is often used as a synonym for reading disability. However, many researchers assert that there are different types of reading disabilities, of which dyslexia is one. A reading disability can affect any part of the reading process, including difficulty with accurate or fluent word recognition, or both, word decoding, reading read, prosody, and reading comprehension. Before the term dyslexia came to prominence, this learning disability used to be known as word blindness. Common indicators of reading disability include difficulty with phonemic awareness, the ability to break up words into the component sounds, and difficulty with matching letter combinations to specific sounds. Reading disorders can be helped, and there are a lot of ways to help a student suffering with dyslexia. Teachers need to focus on giving students extra time to read silently in class, and to never force them to do it out loud in front of the whole class. This can discourage the student from wanting to read. Silent reading time is good for all students, however, will give the student dealing with dyslexia more time to practice on their own, and if they need help they can always ask the teacher. Another aspect to pay attention to is to create a quiet area of the classroom. Doing so will give the student a space to concentrate and not be bothered by the noise of the other students. Disorder of written expression. The DSM-IV criteria for a disorder of written expression is writing skills that fall substantially below those expected based on the individual's chronological age, measured intelligence, and age-appropriate education. This difficulty must also cause significant impairment to academic achievement and tasks that require composition of written text, and if a sensory deficit is present, the difficulties with writing skills must exceed those typically associated with the sensory deficit. Individuals with a diagnosis of a disorder of written expression typically have a combination of difficulties in their abilities with written expression as evidenced by grammatical and punctuation errors within sentences, poor paragraph organization, multiple spelling errors, and excessively poor penmanship. A disorder in spelling or handwriting without other difficulties of written expression do not generally qualify for this diagnosis. If poor handwriting is due to an impairment in the individual's motor coordination, a diagnosis of developmental coordination disorder should be considered. By a number of organizations, the term dysgraphia has been used as an overarching term for all disorders of written expression. Math disability, sometimes called dyscalculia. A math disability involves difficulties such as learning math concepts, difficulty memorizing math facts, difficulty organizing numbers, and understanding how problems are organized on the page. Dyscalculics are often referred to as having poor number sense. Non-ICD-10, DSM nonverbal learning disability. Nonverbal learning disabilities often manifest in motor clumsiness, poor visual spatial skills, problematic social relationships, difficulty with mathematics, and poor organizational skills. These individuals often have specific strengths in the verbal domains, including early speech, large vocabulary, early reading and spelling skills, excellent rote memory and auditory retention, and eloquent self-expression. Disorders of speaking and listening. Difficulties that often co-occur with learning disabilities include difficulty with memory, social skills and executive functions. Diagnosis: IQ achievement discrepancy. Learning disabilities can be identified by psychiatrists, school psychologists, clinical psychologists, counseling psychologists, neuropsychologists and other learning disability specialists through a combination of intelligence testing, academic achievement testing, classroom performance, and social interaction and aptitude. Other areas of assessment may include perception, cognition, memory, attention, and language abilities. The resulting information is used to determine whether a child's academic performance is commensurate with his or her cognitive ability. If a child's cognitive ability is much higher than his or her academic performance, the student is often diagnosed with a learning disability. The DSM-IV and many school systems and government programs diagnose learning disabilities in this way. Although the discrepancy model has dominated the school system for many years, there has been substantial criticism of this approach among researchers. Recent research has provided little evidence that a discrepancy between formally measured IQ and achievement is a clear indicator of LD. Furthermore, diagnosing on the basis of a discrepancy does not predict the effectiveness of treatment. Low academic achievers who do not have a discrepancy with IQ appear to benefit from treatment just as much as lower academic achievers who do have a discrepancy with IQ. Response to intervention. Much current research has focused on a treatment-oriented diagnostic process known as response to intervention. Researcher recommendations for implementing such a model include early screening for all students, placing those students who are having difficulty into research-based early intervention programs, rather than waiting until they meet diagnostic criteria. The performance can be closely monitored to determine whether increasingly intense intervention results in adequate progress. Those who respond will not require further intervention. Those who do not respond adequately to regular classroom instruction and a more intensive intervention are considered non-responders. These students can then be referred for further assistance through special education, in which case they are often identified with a learning disability. Some models of RTI include the third tier of intervention before a child is identified as having a learning disability. A primary benefit of such a model is that it would not be necessary to wait for a child to be sufficiently far behind to qualify for assistance. This may enable more children to receive assistance before experiencing significant failure, which may in turn result in fewer children who need intensive and expensive special education services. In the United States, the 2004 Reauthorization of the Individuals with Disabilities Education Act permitted states and school districts to use RTI as a method of identifying students with learning disabilities. RTI is now the primary means of identification of learning disabilities in Florida. The process does not take into account children's individual neuropsychological factors such as phonological awareness and memory, that can inform design instruction. By not taking into account specific cognitive processes, RTI fails to inform educators about students' relative strengths and weaknesses. Second, RTI by design takes considerably longer than established techniques, are often many months to find an appropriate tier of intervention. Third, it requires a strong intervention program before students can be identified with a learning disability. Lastly, RTI is considered a regular education initiative and is not driven by psychologists, reading specialists, or special educators. Assessment. Many normed assessments can be used in evaluating skills in the primary academic domains: reading, including word recognition, fluency, and comprehension; mathematics, including computation and problem-solving; and written expression, including handwriting, spelling, and composition. The most commonly used comprehensive achievement tests include the Woodcock-Johnson IV, Wechsler Individual Achievement Test 2, the Wide Range Achievement Test 3, and the Stanford Achievement Test 10th edition. These tests include measures of many academic domains that are reliable in identifying areas of difficulty. In the reading domain, there are also specialized tests that can be used to obtain details about specific reading deficits. Assessments that measure multiple domains of reading include Gray's Diagnostic Reading Tests 2nd edition and the Stanford Diagnostic Reading Assessment. Assessments that measure reading subskills include the Gray Oral Reading Test IV, 4th edition, Gray Silent Reading Test, Comprehensive Test of Phonological Processing, Tests of Oral Reading and Comprehension Skills, Test of Reading Comprehension 3, Test of Word Reading Efficiency, and the Test of Reading Fluency. A more comprehensive list of reading assessments may be obtained from the Southwest Educational Development Laboratory. The purpose of assessment is to determine what is needed for intervention, which also requires consideration of contextual variables and whether there are comorbid disorders that must also be identified and treated, such as behavioral issues or language delays. These contextual variables are often assessed using parent and teacher questionnaire forms that rate the students' behaviors and compares them to standardized norms. However, caution should be made when suspecting the person with a learning disability may also have dementia, especially as people with Down's syndrome may have the neuroanatomical profile but not the associated clinical signs and symptoms. Examination can be carried out of executive functioning as well as social and cognitive abilities but may need adaptation of standardized tests to take account of special needs. Assessing process for Latino English language learners. Demographers in the United States report that there has been a significant increase in immigrant children in the United States over the past 2 decades. This information is vital because it has been and will continue to affect both students and how educators approach teaching methods. Various teaching strategies are more successful for students that are linguistic or culturally diverse versus traditional methods of teaching used for students whose first language is English language. It is then also true that the proper way to diagnose a learning disability in English language learners differs. In the United States, there has been a growing need to develop the knowledge and skills necessary to provide effective school psychological services, specifically for those professionals who work with immigrant populations. Currently, there are no standardized guidelines for the process of diagnosing English language learners with specific learning disabilities. This is a problem since many students will fall through the cracks as educators or be unable to clearly assess if a student's delay is due to a language barrier, a true learning disability. With an unclear diagnosis, many students will suffer because they will not be provided with the tools they need to succeed in the public education school system. For example, in many occasions teachers have suggested retention or have taken no action at all when they lack experience working with English language learners. Students were commonly pushed toward testing, based on an assumption that the poor academic performance behavioral difficulties indicated a need for special education. Linguistically responsive psychologists understand that second language acquisition is a process, and they understand how to support EL's growth in language and academically. When ELs are referred for a psychoeducational assessment, it is difficult to isolate and disentangle what are the effects of the language acquisition process from poor quality educational services, from what may be academic difficulties that result from processing disorders, attention problems, and learning disabilities. Additionally, not having trained staff and faculty becomes more of an issue when staff is unaware of numerous types of psychological factors that immigrant children in the U.S. could be potentially dealing with. These factors that include acculturation, a fear and/or worry of deportation, separation from social supports such as parents, language barriers, disruptions in learning experiences, stigmatization, economic challenge, and risk factors associated with poverty. Unfortunately, in the United States, there are no set policies have been enforced to mandate that all districts employ bilingual school psychologists, nor are schools equipped with specific tools and resources to assist immigrant children and families. Many school districts do not have the proper personnel that are able to communicate with this population. Laws and role of a school psychologist. Schools in the United States have a legal obligation to new arrivals to the country, including undocumented students. The landmark Supreme Court ruling While v. Doe grants all children, no matter legal status, to a free education. This ruling suggests that as a country we acknowledge that we have a population of students with specific needs that differ from native speakers. Additionally, specifically in regards to ELs, the Supreme Court ruling Lau v. Nichols ruled that equal treatment in school did not mean equal educational opportunity. Thus, if a school teaches a lesson in a language that students do not understand, then they are effectively worthless. This ruling is also supported by English language development services provided in schools. But unfortunately, these rulings do not require the individuals that teach and provide services to have any specific training, nor is licensing different from a typical teacher or services provider. Assessment process of Spanish-speaking EL. A well-trained bilingual school psychologist will be able to administer and interpret assessment all psychological testing tool. Also, an emphasis is placed on informal assessment measures such as language samples, observations, interviews, and rating scales, as well as curriculum-based measurement to complement information gathered from formal assessments. A compilation of these tests are used to assess whether an EL student has a learning disability or merely is academically delayed because of language barriers or environmental factors. It is very unfortunate that many schools do not have school psychologists with the proper training nor access to appropriate tools. Also, many school districts frown upon taking the appropriate steps to diagnosing EL students.